Hi Annik, welcome. Can you shortly introduce yourself?
Sure, nice to meet you, Lode. I am Annik Leliaert and I'm working as HR manager at the University Hospitals of Leuven, where I'm responsible for the care workers of women and child, the psychologists and the social workers.
Do you have a return to work policy and what does it involve?
It involves a lot because there are many stakeholders involved when an employee is returning to work. There is a supervisor, the HR department, the employee himself, of course, the occupational health services. And we're working from a point of view that there is shared accountability and also the responsibility of everyone to give maximal support. So it's a rather complex situation, but with all those stakeholders, we're trying to develop a policy in which for each individual we can develop a specific situation.
When you introduced the policy, was it done in a sudden way or is it more a continuous improvement process?
It's not a fixed policy which is introduced in a one special moment because there is continuously improvement and adaptation also in the prevent absence. And but I think that which is really important when there is a new part of the policy, there is organization broad communication to all the leaders, to all the supervisors. Each supervisor takes part in a communication program each 2 months where is it communicated. And on the other hand, we're also investing in training and development. Each new supervisor is obliged to follow a training in collaboration with our occupational health service to know what to do with employees to prevent absence, but also to facilitate the returning to work.
What would you define as the main drivers for a successful implementation of a policy?
The commitment of some supervisors and to engage them in developing new policies, because it's they who has to implement them. The communication with social partners, because they also are an important partner to support our employees, and the organization broad communication, not only to supervise social partners but also to employees themselves, so that they know what the possibilities are to get support for returning to work.
I can imagine when you introduce a new policy that there might be some resistance. What do you think are the main barriers?
I think the main barrier is the belief of supervisors that it will be possible to reintegrate an employee after a long period of absence. Because each supervisor has his own budget of full-time equivalents, and when someone is returning to work after a long period, that might undermine the competencies in his team. But on the other hand, there are also some solutions. We have on the level of organization a rather small budget to support those teams to reintegrate these employees.
Do you have any giveaways for the people attending this course?
Yes, I think you have to communication. I know it's an open door, but it's true, communication. And when you develop a new policy, invite a few supervisors to work with you to develop, because it's really important for them that it's a concrete policy and which is also feasible to obtain or to realize. And I often hear from supervisors that they want to get involved to develop those policies. So,
thanks a lot, Annik, for this interview and sharing your experiences and expertise with us. For you who are interested in more information, have a look at the MOOC and this module.